Hey everyone, and welcome back to the channel. Today, we're diving into a topic that can feel a bit complicated, but it's super important for millions of Americans. Medicare Part D? What is it? How does it work? And what's new? Let's break it all down in a way that's easy to understand. So, what exactly is Medicare Part D? Simply put, it's Medicare's prescription drug coverage. You can get it in two main ways, either as a standalone plan that works alongside original Medicare, or as part of a Medicare Advantage plan, often called an MAPD. These plans are offered by private insurance companies approved by Medicare, so your options and costs can vary quite a bit depending on where you live. Now, let's talk about how these plans actually work. Each Part D plan has its own list of covered drugs, called a formulary. It's crucial to check this list before you enroll to make sure your specific medications are included. These formularies are usually tiered, meaning drugs in lower tiers will have lower copayments than drugs in higher, more specialized tiers. A key part of understanding Part D is knowing about its coverage stages. For 2024, there are 4 stages you might move through during the year. First is the deductible stage. This is the amount you have to pay out of pocket for your prescriptions before your plan starts to pay. In 2024, no plan can have a deductible higher than $530, and some plans have no deductible at all. Once you've met your deductible, you enter the initial coverage stage. Here, you'll pay a copayment or a coinsurance for each prescription, and your plan pays the rest. You stay in this stage until your total drug costs, that's what you and your plan both pay, reach $5,030 for the year. If you reach that limit, you move into the coverage gap, which you might have heard of as the donut hole. In the past, this was a period where you had to pay a much larger portion of your drug costs. But things have changed for the better. In 2024, while you're in the coverage gap, you'll pay no more than 25% of the cost for both brand name and generic drugs. You stay in this gap until your total out-of-pocket spending reaches $8,000. This brings us to the 4th and final stage, catastrophic coverage. And here's some really big, positive news for 2024. Once you hit that $8,000 out-of-pocket threshold, you no longer have any copayments or coinsurance for your covered drugs for the rest of the year. That's right, your costs drop to 0. This is a huge change from previous years where you still had to pay about 5%. And the good news doesn't stop there. Starting in 2025, there will be a new $2,000 out-of-pocket cap on prescription drug costs for the entire year. This means that once your spending hits $2,000, you won't pay anything more for your covered drugs for the rest of that year. This is a massive relief for anyone with high prescription costs. Another fantastic change is the new smoothing option. It's also starting in 2025 if you're facing high drug costs. You'll have the option to spread your out-of-pocket payments into equal monthly installments throughout the year, instead of facing a huge bill all at once. So, how do you choose the right plan? It's all about doing your homework. Use the Medicare Plan Finder tool on the official Medicare website. You can enter your specific medications and dosages, and it will show you the estimated annual costs for all the Part D plans available in your area. This is the single best way to compare your options and find the plan that saves you the most money. Remember, plans can change their formularies and costs every year. That's why the annual enrollment period, from October 15th to December 7th, is so important. It's your chance to review your current coverage and switch to a new plan if a better one is available. I know this is a lot of information, but understanding how Part D works can save you a significant amount of money and give you peace of mind. The recent changes are making prescription drugs more affordable than ever, so it's a great time to be proactive about your healthcare. If you found this video helpful, please give it a thumbs up and consider subscribing for more easy-to-understand guides on navigating your healthcare options. If you have any questions, drop them in the comments below, and I'll do my best to answer them. Thanks for watching, and I'll see you in the next video.